to address the gut-brain axis, because aren't we all a little bit worried, not so much about our guts, but about our brains and chronic onset of some neurodegenerative disease? That's not a pleasant thought. And then hormones and immune, that would be related to anything to do with your immune system, whether it's a post-COVID, long-haul COVID type reaction, or people that are worried about different forms of cancer that they may develop. So we're trying to address all the different chronic illnesses and be able to detect and understand the mechanisms that trigger these diseases long before they would appear in a person, so you can have healthy patients. And then there's another layer on top of that, I think, that we can talk about, which is once you have a healthy patient, you have organ systems that are healthy, you have cells that are healthy, then what do you do with that health that they've created? Well, that's a whole nother can of worms. Then you get into things like meditation practices and breathing exercises and heat exposure and cold exposure and physical fitness and VO2 max levels and muscle strength and develop and all those kinds of things. And that has to be a component to the program as well. And so as we're going through this, we as practitioners have to be doing these things ourselves as well too. So you have to have at the end of this year a sauna and a cold plunge and a personal trainer, or figure out how that you're going to exercise and do strength training and get your VO2 max to where it should be and have your diet dialed in, right? We have to be the living embodiment of these programs in order to be able to sell them to our patients.